There's many ways, I think, over the COVID period that you've been able to keep in touch with your patients, and some people have done that very well. I've had some of my groups that I help sending weekly Facebook messages, and they've really stepped out of their comfort zone to, you know, get onto camera and blurt out a 5-minute blast on a Friday. Hi, this is Dr. Such and Such, just thinking of you, da-da. And I encourage people, even if you haven't done that, start doing it. Really show people who you are. It doesn't have to be perfect. As Prabin knows, I am the worst person to get on video. I hate it, and he's kicked me in the backside for years. Thank you, Prabin. Because people don't want to see my face. They don't want to see my face. But you know what? I think we do every time. I say this to my clients, and then I don't do it. So I really want people to have a really good think about connecting constantly. People don't have to tune in and listen to you for the whole 5 minutes. I think Rob's on the line. Rob did a gorgeous video where he used black paint to actually, with gloves on, to actually show how soap covered his hands and how it was so important to wash in a particular way. And I'd never seen that in 35 years. And I went, wow, that was awesome. And, you know, just knowing that this dental practice that you go to actually washes their hands properly and why, was a big tick for me. So it's a way to let people know where you're at. Some people have just been ringing their clients and saying, hi, we haven't forgotten about you as soon as we're open again. Some people have been emailing. I tend to think that emails get lost a little bit. I'm a shocker with emails myself. And, but do them anyway. Just keep them going through, keep them short, keep them on point. Don't dribble on, because any lengthy email often just goes into my rubbish bin. And if you haven't done that, don't worry, it's just not too late. Start now. Just, there's got to be some techie savvy person in your business. It might be your steri nurse. It could be your associate dentist. Just get in there and just blast it out over your Facebook page. That's where your patients are. Yeah.
That's a great point. That's a great point, Sue. And if I can, you know, if I can add something, obviously,
Absolutely.
as we are seeing as well, you know, they are sending the emails or, you know, posting on the Facebook to the, you know, to the existing patients, or we would say as a inactive patients as well, number of wise. But what we have also found is sometimes, especially if they are doing the practice or the practice manager, whoever is doing the marketing, they just send one hit. And as you know, we are so bombarded with so many messages. So when we send one message and, you know, and I talk with the practice manager, oh, we have just sent an email, but who will check one email? So what we were saying is at least 3 to 5 touch points it should be. So what does that mean is not changing the offer or anything, but if you're talking about the theme is, let's say, you know, patients, you know, activating the patients or any themes you want to choose, then probably use the same theme in your, you know, in your online as well as your offline. So the whole idea is there is a consistency in all the things, and there is a number of touch points. So it's not just one message or one phone calls, isn't it, Sue?